Hello, hello, hello. Welcome to our broadcast for today. Today we got a good one for us. But before we proceed, I implore you to subscribe to our video, leave your comments, share this video. This is a free broadcast. The best thing you can do for us as we dig in to provide this free service, to share it with anyone who is dealing with mental illness, or their family members, caregivers, professionals, pastors, as many as care. Please share the video. Share it with anyone who takes care of others. Share the video. Having said that, we need to move forward. Today we have a good one. We're going to be talking about how to support someone who is dealing with mental illness. How do we provide support, especially when a loved one has just had their first psychosis, or they are going through the first mental illness, they are going through the first depression, or anxiety is just emerging. The person's character and the way they live, the way they talk is changing. We've gone to the first hospital, we're just back. We're not sure what to do beyond that. We're given slews of medication, and then we're not sure how to help this person. I'm going to tell you all about it and prepare you so that you will be more effective as a practitioner, more effective as someone who is dealing with the illness, and more effective as a caregiver. The first thing that we need to know is that this is an illness. It's not a virus that comes and goes. It's an illness, and it has its own symptoms. We're not going to wish it away. We may pray it away if we have faith, but that's spirituality. But we have to know that this person is going through something that is changing them. So once we recognize that, accept that, it helps us to begin to adjust to how we provide help. The second thing that we need to do is to make a point of reaching out. A lot of people who deal with depression, anxiety, or several other illnesses tend to isolate. They want to be by themselves and with themselves. Sometimes we think that the best thing to do is to leave them alone. Yep, some of it, but a lot of it will be reaching out and lovingly or carefully helping them to come out and engage. Reach out, ask the person, how can I help you? Oftentimes you're going to get, don't worry, I'm okay, I'm going to be okay. Come back out and say, you want to come out and watch TV with us? Reach out, whatever you do. Try and reach out to the person. The second thing we do, which is harder to do than it sounds, is develop a listening ear. Learn to listen to the person. Learn to listen to their whining. It may sound like whining and complaining. It may even sound absurd. Someone says, I'm sad, and you're looking at that person, they have no reason to be sad. They say, I'm tired. They've been sleeping all night. They've slept for 14 hours, 10 hours. They're still saying, I am tired. I don't feel like going anywhere. So it doesn't make sense. But sometimes all we need to do is to provide a listening ear and empathize, show sympathy. What can I do to help? Have you eaten? Do you want to eat? Can I get you something to drink? That's what to do to help. Saying, no, you've been sleeping all night. You've been lying here all day. Get up. That doesn't help. That doesn't make the fatigue that they're going through go away. Support healthy habits. That's number 3. Support healthy habits. What are those healthy habits? Exercise, eat right, go to bed, take your medication, do whatever the doctor says. We provide that support. Get up, take a shower, get up, take a walk outside, come outside, watch TV, sit down with us, eat some meal. Those are healthy habits that would help this person to continue to recover. Take your medication. And that's number 4. Number 4, help them to take their medication. If they have prescription medication, it's easy for them to forget. Help them, remind them the time to take the medication. If the person is suicidal, if they have suicidal ideation, obviously what we do, we take the medication away from them and we provide medication daily for them. Provide the dosage for the day, or the what they are supposed to take for the day. What a lot of people do is they just bring out what is for the day and give it to the patient and remind them, you take this in the evening, take this at night. Why do we need to do that? Why we need to do it is for a lot of people who are dealing with mental illness, they are forgetful. They forget. The next reason why we want to do it, there are after effects that come from medication that make a lot of them not want to take it. So we got to encourage. The third reason why we want to help them manage their medication is that sometimes when they begin to feel good, they think, oh, I can do this without this medication that makes me sleepy. I can do this without this medication that makes me not feel nauseated. I can do this on my own. Problem is, you're feeling good because the medication is helping you. If you leave what is helping you, you're going to go back to where you come from. So help them manage their medication. The fifth reason why you want to help them is so you can keep tab of when they run out and order ahead of time or refill ahead of time before they run out of medication. If someone is dealing with mental illness and they are taking medication for depression, anxiety, or any other disorder that they are taking medication for, it needs to be consistent. They need to be in compliance with medication. They can't take it today and leave it tomorrow. So one thing you can do is to help them manage it, encourage consistency, encourage compliance. The fourth reason why, fourth way that we can help them is encourage professional help. When you see that person deteriorating or beginning to manifest symptoms like isolation, maybe for those who hear voices, you might hear them talking to themselves more, seeing vision, being afraid, developing phobia, not wanting to go anywhere, we might encourage them to seek professional help. It's not just saying, let's go see the doctor. Help them make the appointment. Take them there if you can. And if they allow, sit in with the doctor. The doctor needs your input. As a therapist, I need your input because the patient that is sitting before me does not know what they are doing or what they do when they are in crisis. So I need you who is rational, who is normal, to tell me this is actually what happened. This helps a lot. The patient can only tell me what they know, and oftentimes they don't know what they were doing at that time. So the doctors, the therapists, the caregivers, they need your input. And if I was your therapist, I'm going to go through what I'm going through, what I'm talking about today with you, tell you what to do to help my patient to do well, because it's a teamwork. They see me for an hour, but they live with you 24/7. So the more you know, the better for me and you and the patient. So help them seek professional help. If they are not sleeping well, if they are having a wait for 2-3 days, then it's time to go see a doctor. Maybe the medication is not working. Maybe they need to increase it. Maybe they need to decrease it. Maybe the doctor needs to do something. Help that person to go. The next thing that you need to do is to connect them with social support. Those who are fully recovered or recovering, now they are isolated. They are not connected to their friends. We have to help them to connect with the right support. If prayers is something that encourages them, connect them to a prayer ministry. If what helps them is to talk to their friends, connect them with people. Connect them. There are a lot of organizations and groups on social media that are dedicated to specific disorders. If you go to Facebook, you Google depression support groups, you will see 1,000 of them. Help them to connect with those people. You don't need to join with your own name. You don't need to say anything. Just join and see what others are doing. Community, when it comes to health, is strength. So help them to connect with social group. The next thing that you need to do is take suicide seriously. Anytime that someone says, I want to kill myself, I don't feel like living, I'm tired of living, all these are signs and indications of suicidality. So we want to really probe. If you don't know how to probe, take them to someone who can. A therapist can, a psychiatrist can, help them to get professional help when there is any mention of giving up, hopelessness, helplessness, tiredness, whatever it is an indication that this person doesn't want to live, doesn't want to fight anymore. It's momentary, it's temporary. At that time, we need intervention to save them from that crisis, because you don't want what they are thinking to happen. And for you, who is caring, who is supporting, who is treating, make time for self-care. Make time to take care of yourself. Look, this is a disorder. It's not a disease. It's not a virus. It's not going away soon. And that's one question that I also have here. A lot of people ask me. Often the family members will say, how long are we looking at? When is this going to be over? Because of the burden of mental illness, and now someone who is talking rubbish, someone is having psychosis. They are seeing things that nobody else is saying. They are saying things that nobody else is hearing. They are doing all those things that can be a burden to the family. So they want to know how soon. When do we expect this to be resolved? And I tell you, I often tell them, we don't know. This is a disorder. This is probably going to be with him or her for the rest of his life or her life. But the good news is, if he manages it well, he won't have crisis often. But any time that he does not manage his health well, he goes through crisis, goes through stress that are extreme and overwhelming. There's a likelihood that you're going to get this crisis. Those who suffer from depression go through it once, twice in a year. Depression that are not manageable. Those who have anxiety live with it. They just have to develop coping skills, how to deal and manage with the illness. So you that is a caregiver, you that is a therapist, a professional, if you haven't developed ways of taking care of yourself, do so. If you are a therapist like me, I see about 20%, 30% a week. All of them have things that they are dealing with. They are not dealing with good stuff. Now, from time to time, you get good news that someone has finally been able to go to that store, go to social events that they haven't done for years, or gotten a job that they haven't gotten for years, and it makes you feel good. But for the majority of it, it's bad news, negative news that you're dealing with day in, day out. If you don't develop coping skills, you're going to burn out. So you have to find a way to take care of yourself. If your mom or dad, or if you're the one who's taking care of someone who is autistic, for instance, you have to develop self-care, how to take care of yourself so you can keep going. You don't want to break down. You do not want to break down. So as much as you're taking care of people, take care of yourself. Have ways that you take care of yourself. And finally, this morning, I want to say you are not responsible for curing. You are responsible for caring, not for curing. There's very little thing you can do for that person for the illness or disorder to go away. So you provide what you can, which is caring for the person, going through what I've said today, providing support, providing listening ear, helping that person manage their medication, helping that person maintain healthy habits. That's your arena. That's your job. That's what you do. Forget about when will this end. It's not up to you. So, and if it doesn't end, if they get worse, it's not because of you. So your role is to care, not to kill. The curing comes from God. The healing comes from God. Just provide the care that you can. And for those who are in the industry as professionals, I want to tell you this can be a very frustrating profession to be in. You might be with somebody on Friday, they're looking good, they're sounding good, everything's going well. On Monday, they are expressing serious suicidal tendencies. Or they're hearing voices. Things are happening on Monday. It can be frustrating. You may be making progress, and before you know it, it's a step backward. You have to be able to put things in context. The progress made is progress. Just because there is a relapse doesn't mean that whatever progress we made has gone away. He has learned some skills that helped him to make that progress. So that means that this crisis is going to be able to get out of it quicker, because now he has tools. Now he knows he can get out of it. So we don't take it personal when there is a relapse. It's not about us. We provide and do the best that we can. The client, the patient, it's up to him to do the rest. So thank you all. Thank you for watching. Once again, if you've been watching this video, subscribe to this channel. If you've been watching this video and you want to learn more, the Institute for Marriage and Family Affairs, the organization that I represent, has tons of courses on mental illness. We call them the Essential Skills certifications. So if you're interested, just type in your name, I am interested, go to our website, which will be provided at the bottom, log in there, you'll see tons of courses that we are offering that would help you to be that consummate professional, to be that equipped to be effective. If you are a caregiver, you can take some of these certifications and arm yourself. Excuse me. I can only do this for 30 minutes or 20 minutes or 10 minutes, but those courses are 2 hours, 3 hours. It really guides you step by step as to what to do. If you are a marriage and family counselor, you are a pastor who deals with these things, we have courses that can help you to enhance your skills, to be more effective than you are now. So go to our website, click the link, and it will take you to teamfa.org. And there you will see our series of courses. We have one that is coming up in June. It's called the Certified Mental Health and Addiction Counseling course. So that's for 14 weeks. It will help you to learn how to treat and provide support professionally, coaching, counseling, drug addicts, coaching, counseling, those who are dealing with mental illness. Again, that's also on in our website. You can find all those information there. Once again, share the broadcast, subscribe to us, and God will bless you. See you next week. This has been Your Families and Mental Wellness. Thank you. God bless you. Bye-bye.